Welcome to Citizens Reunited to Overcome Cancer, a show to make your survivorship an easier journey by providing information and advocating for you. A show to help practitioners and their level of performance. This is the CROC podcast. Here is your host, Dr. E. And alongside him to share some hope and inspiration from the Have Faith, Let It Begin podcast, co-host Angel Santana.
Hello, everybody, and welcome back to the CROC podcast. CROC stands for Citizens Reunited to Overcome Cancer. This is your cancer survivorship platform. I am Dr. Tommy Anelli. I am the skipper of this spirit ship. Joining me as my co-host, as well as my first mate, Robin to my Batman, every week, Angel Santana. How are you, my friend?
I am doing really well. We're just editing a little bit because we got the baby in the background. But you know what? Parenting is good. CROC Podcast is good. And I'm good, buddy.
Excellent. Well, that's nice to hear. We have a very, very exciting podcast. It's going to be a little scary to you all. And it is a two-part podcast because this week and next week, we're going to be talking about artificial intelligence. I know what you're thinking. If you're my age, if you're in your 60s, or even if you're in your 50s, artificial intelligence, your first encounter with artificial intelligence was probably Arnold Schwarzenegger coming back from, believe it or not, Angel, that movie came, it was in 1984, but actually the Terminator himself came from the year 2029, which means we're not too far away from that apocalyptic possible future. And that was, I guess, our first experience with AI gone wrong. Anybody a little younger than that probably remembers the disaster of AI in The Matrix, right? With Keanu Reeves and all that kind of stuff. And most recently, actually a few months ago, Sam Rockwell came out with a movie called Good Luck, Have Fun, Don't Die, another end of the world if we don't save the world from artificial intelligence. So I know, I understand, everyone, this is a scary subject and I get it. However, we are at the precipice. We are right on the edge of something great that's going to happen over the next decade or so. Will it be good? Will it be great? Will it be bad? Will it be, the Terminator? Will it be the end of life as we know it? I don't think so. And I hope that this first part of the podcast will help us keep all of the sharp objects away from any of our fleshy parts and keep you guys away from doing anything silly. I think the clincher of why I decided to attack this subject and bring it to your attention is this past month, I was involved in a very, very huge and important presentation. I was invited to be part of a panel, and on the panel were physicians from Memorial Sloan Kettering and from Mount Sinai, and these are some of the experts of the field, and my job was to not look too dumb. So what I did was I, of course, did my usual E&LE preparation, which is, of course, over the top. But I did for the first time, lean on AI, to help me put my thoughts together, organize my thoughts, organize my references. And I have to tell you, Angel, it was like the greatest experience of all time. I actually slayed it. I made the other doctors look silly. It was really such a wonderful experience. So with that under my belt, I feel a little bit empowered to give this podcast. So without further ado, what we're going to talk about today in the first part of the podcast is we're going to talk about how AI can help our survivors have a better survivorship. So we're going to do it in 5 parts along with a warning or a caveat. We're going to talk about organization. We're going to talk about comprehension. We're going to talk about preparation, advocacy, expertise, and then, as I said, end with a warning. So again, do not get too nervous. Do not start losing your cool. This podcast, AI, it's not about replacing physicians. It's not about replacing nurses. It's about common sense. It's about giving you guys, the survivors, something that you really have needed and not even known you needed it for years. AI is a way to better organize your medical information, understand your treatment history, become a better advocate for yourself and for your care. And if it's used properly, AI may be the most powerful survivorship tool, of course, other than the CROC podcast, that we've ever seen. So let's start with a simple fact. Let us consider that out there, listening to this podcast, hopefully, are millions and millions of cancer survivors just in the United States itself. And many of you guys are going to live for years. Many of you guys are going to live for decades. And that's a wonderful thing. And that's why we are here. We are here to help you survive your survivorship. But besides it being one of the greatest success stories in medicine, it doesn't take away the fact that survivorship is complex and has many challenges. And when your treatments end, you become the custodian of an enormous amount of information. You have your pathology reports, your operative reports, your radiation records, your chemotherapy records, your imaging studies, your laboratory studies, your genetic testing, your specialist consultations, the hospital admissions, your emergency room visits, your medication lists. On average, each of you as a survivor has accumulated thousands and thousands of pages of records over time. And to be honest with you, that is overwhelming. And you guys, I'm going to speak for all of you, have no idea where half of that information is. Every day in the clinic, people come into my office and I sit down and we talk. And after I get to know you, I ask you about your cancer. I ask you about your history. I ask you about if you've ever had any treatments before. And your answers are, I don't know. I'm not sure. No idea. No idea. And that's not good because we need to know these things. And do we need to know these things just because we're trying to check boxes? Are we just busting your chops? No, we need to know these things in order to take care of you properly. So if I ask you, you've had radiation 20 years ago, where did you have it? What did you get? That's an important question because medical records are going to be purged after 7 years. Hospitals and doctors can't get rid of hospital records quick enough, and that's a bad thing. So what does that mean though? So say I have to treat you for cancer and you've had radiation to your spinal cord 20 years ago, and I have to give you more radiation to that area. I could potentially paralyze you, and I don't want to do that. What kind of chemotherapy drugs did you have? Did you ever get, adriamycin? Why are we asking you that? Why is Dr. Perry, Dr. Kundagunda, Dr. Stewart, why Dr. Dinsmore, why are they asking you these things? Because they want to know if your heart is going to be safe if you need further adriamycin. Did you ever get cisplatinum? Why do they want to know that? They want to make sure your kidneys and your hearing are preserved if you need more. If I ask you, okay, you had your prostate taken care of 20 years ago. Did they treat your lymph nodes? Why am I asking you that? Because I have to know if you have a positive lymph node, I don't want to retreat you and then burn your bowel. Did you ever have any genetic testing? What was the stage of your cancer? What were the surgical margins? These are not trivial questions. These are very important questions, and the answers will influence your future treatments. So they will impact your future screening recommendations and even your future diagnoses. So most of you guys, most of our survivors don't have any access to this information. And I know what you're going to tell me. You're going to say, Dr. E, we have my chart. Well, quite frankly, I'm glad we have my chart. It's a start. It's a beginning, but my chart sucks eggs. I got to tell you, I have seen patients try to get into my chart in my office. Yeah, I have that. I had this blood drawn 2 days ago. Yeah, let me get it for you. 3 hours later, as they say, as I'm falling asleep waiting for them to get to my chart, nothing's happening, right? So my chart, maybe it'll be something in the future. It's certainly better than having nothing. But I implore you, AI for organization is so much better. Let me give you a little peek as to what I'm talking about. So imagine taking all of your medical records and placing them on an AI platform. So you take your records, you scan them into the computer, you feed them into your AI platform. Within minutes, your AI will organize everything. You could even give your AI a name. My AI's name is Zin, Z-I-N, named after my cousin who passed away last year. So every time I need a question, I say, hey, Zin. It makes me feel warm and cozy, like I'm honoring my cousin. You can call it Angel. You could call it Diana. You could call it anything you want, but call it something. You will not get hundreds of pages of summary. You will not get thousands of pages of summary. You will get a concise survivorship summary of everything you've been through. You'll get your cancer diagnosis. You'll get your staging. You'll get your pathology, your treatment dates, your surgery dates, what surgery you had, what chemotherapy you had, what radiation you've had, if you've had any recurrences, if you've had complications, what medications you're on, what the follow-up recommendations are, all in one place. And it will spit out whatever question you ask them. Zin, when did I have radiation therapy with Ianelli for my prostate? And Zin will tell you, you had 28 days of radiation therapy in 2016 with Ianelli, and you had a great time and you really loved him. You thought he was really cool. AI will tell you that. They might not tell you how cool I am, but it'll tell you everything else. So instead of searching through your file cabinets or your folders or your portals, all you have to do is say, Zin, when did I complete my radiation therapy treatments? And you'll get an instant answer. So imagine this. So at your fingertips, all of your medical information, easy to parse, easy to retrieve, anywhere, anytime. You're on vacation and your appendix bursts and you go into the emergency room and your physicians know that you're complicated because you're a cancer survivor. And they say, can you please give me a history, a medical history about your cancer? You take your phone, you say, Zin, I'm getting my appendix just burst. I have to have an appendectomy. My doctors need to know my history. Can you help me? And within seconds, the doctor will take your phone. They'll read everything. Everything will be there for you. So that's number one, organization. Very powerful. Number two is comprehension. I have to tell you, we talk about this all the time on this podcast, how our language, our medical language is absolutely deplorable. It's complicated. It's convoluted. It's in Latin root. You guys are lost. So every day you come in and you come in with your reports on the My Chart. I just got this, this CAT scan and I think I'm dying. No, you're not dying. Those are cysts in your liver. You don't have liver metastasis. Those SUV units, they're basically background. Your spleen is not cancerous. That's normal. And AI can tell you all this. It can give you a comprehension of what's going on in real time with your life. It could explain your pathology reports. It could explain your radiology reports, and it could explain questions you may be afraid to even ask your doctors. And let's face it, you guys leave your doctor's offices, you don't remember anything that we said anyway. You can actually tape, you could actually record us and have AI give you a summary of what your visitation with your doctors were all about. And I'm not putting you down because I'm a patient too. Angel's a patient. We're the same. I mean, just because we're doctors and Angel works in a hospital doesn't mean that we're different than you guys. All of this stress, all of this, misunderstanding, it's very normal. Cancer is very stressful. We talk about this every week. AI can be your interpreter. It doesn't replace, AI does not replace, let me repeat this. AI is not there to replace medical advice. AI is not there to make a diagnosis, but it's there to translate medical terminology into plain English. It's there to help our survivors understand what their doctors are saying. It's there to help our survivors formulate questions to ask their doctors. And it's there to help you guys become active participants in your care. Number three, It's a preparation tool. So your doctor says, hey, Joe, you have prostate cancer. You need to see Dr. Yanelli. So you leave and you say, Zin, who is Dr. Yanelli? Tell me all about Dr. Yanelli. And I actually had AI do that. And thank God for the most part, AI tells me I'm a pretty good doctor, that people like me and that they've had good experiences with me. Not 100%, of course. I don't think no one is 100%, but certainly enough where I think people wouldn't be afraid to come to me. And you can get to know where I went to school, where I trained, how long I've been doing this, what my interests are, all that kind of stuff. Actually, you could even find some of our videos, Angel and my video of this podcast, as well as some of my old videos of some of my lectures that I've given to survivors. So it's all there on AI, whether you want it or not. If I have a criminal record, it'll be there. I don't, thank God, yet, but there's always time, so hopefully nothing there that would scare anybody. In addition, you want to be able to know what to ask your doctor. So you're walking in for the first time and you want to be, as I said before, an active participant in that consultation. So instead of coming in frightened or confused, you're going in there prepared. And that's a powerful thing. Number 4, advocacy. And to be honest with you, advocacy, Angel, is really where AI becomes transformative. All of our survivors eventually discover that navigating healthcare is impossible. So you have appointments to worry about, insurance to worry about, prior authorizations, second opinions, disability forms, work accommodations, work letters, medical record requests, financial assistance applications, and it's just too much. AI can help you identify these resources, generate organized questions, create timelines for you, prepare summaries, track your deadlines, maintain your documentation, and in many ways, it can function like a personal healthcare organizer. Number 5, you guys become experts in your cancer. You become almost, really, to be honest with you, you're not doctors, you didn't go to medical school, but you'll know more about your cancer than your primary care will know about your cancer. You'll know about your stage, you'll know about your prognosis, you'll know about your treatments, and more importantly, information is changing so rapidly. There's so many new treatments, so many clinical trials, so many guidelines that you'll be more on top of this than even your oncologist, because keeping track of all this can be very difficult. So AI can help you summarize this new information and explain it, as I said, in simple language. Again, not to replace your doctors, not to replace your nurses, but helping you stay informed and helping them, your care team, engage with you in a meaningful conversation that you could become part of. Now, I promised I was going to give you a little warning, so I'm going to tell you 2 things to watch out for. So every tool comes with limitations. AI is no exception. So artificial intelligence, I'm going to tell you right now, is not perfect. It's not even close to being perfect. AI makes mistakes. They make a lot of mistakes. It could misunderstand information. It could be wrong. And what's even worse, it could be wrong confidently, which means that it'll spit out this information like it's the world, resource for this particular answer, and it could be completely wrong. And that's why you have to understand a simple rule. AI should support medical decision making. It should never replace your medical decision making. The final authority remains with you and your healthcare team always. So think of AI like a GPS in your car. So you want to go to Angel's house because Angel is having a picnic and a barbecue and he's making hot dogs, and it's going to be great. He's going to give everyone a shovel to try to kill his, all of his critters and varmints in his yard. So it'll tell you how to get to his town. It can identify the routes. It can warn you about traffic. But if the AI tells you that you have to drive into a lake to get to his house because a new lake just was put in, guess what? You're not going to drive into the lake. You're not going to jump off a bridge. And you just have to use your common sense and use your judgment. And that same principle applies here. AI is a tool. It's a powerful tool, but it's still a tool. Second thing I want to warn you about is privacy. So remember, your information on your computer is only as good as how you could protect that information. So please make sure that any medical information that you're feeding to AI is any personal information, any financial information, that where you store this is protected. Make sure your platform is safe. Make sure you have privacy protections, and make sure you know how that information is being handled, because these questions matter and they deserve your careful consideration. We'll probably have our next guest in our next podcast about AI talk a little bit about that as well. But despite all these concerns, Angel, I remain not just optimistic, I remain very optimistic. I see a future without any Terminators walking around trying to assassinate us. I see a future and a new generation of survivors that are informed, that are empowered, and are confident, because I have seen what technology can do. I have seen what can do. I am watching in real time patients becoming more informed. I am watching families organize complicated medical histories. I'm watching individuals who felt overwhelmed suddenly gain clarity, and clarity is empowering. And I have personally experienced the potential of this tool. So I often tell patients, and maybe on a daily basis, that cancer can take many things away from you. It can take away certainty, and it can take away control, and it takes away predictability. But one of the hidden gifts of AI may be that it gives some of that control back to our survivors. Not necessarily control over the disease, but control over the information, control over the understanding, control over the communication, and control over your advocacy. And that's probably the most exciting part. I see a future where the cancer survivor will not need to carry around giant folders of medical records. They will not have to struggle to remember treatment details from 10 years ago. They will not need to spend hours searching through portals and paperwork. Instead, they will have an intelligent assistant helping them organize, understand, and access their healthcare information whenever they need it. Again, not replacing doctors, not replacing human compassion, not replacing experience, simply helping patients navigate an increasingly complex world. And if that happens, Angel, I believe cancer survivorship will become stronger, smarter, and more patient-centered than ever. Angel, your thoughts?
I mean, this is a great topic. Let's just be real, right? We're living in an era where AI it's here. And closing out the conversation, I'd like to leave with this version of my final thought about artificial intelligence in the medical field. I believe AI is one of the most remarkable tools ever developed, and it has the potential to help the doctors detect the diseases and earlier, assistance in researching and discovering the new treatments and improve patient care. But from a spiritual aspect and perspective, I also believe there is something AI can never replace. But I won't get into that. What I will get into is this. I believe technology has been given to us for a reason and a purpose. And guess what? We need to take this to the next level and not replace humanity, but strengthen it. And I think what you just explained from your perspective on how the strength of AI is going to only better us as human beings and also better our future is one way that we can say, I am blessed to be in the era of AI.
Awesome, Angel. Thank you so much. I'm so excited, everybody, for part two. I hope that this was a helpful podcast. Please let us know. Please leave your comments, as always, either directly to Angel or myself. We will get back to you. So ending up, we're a bit over today. I apologize. It was a very complex subject, but I will end with our CROC blessing on behalf of Angel and the entire CROC Board of Directors. As always, wishing you a long, healthy, happy, cancer-free life. God bless you. God be with you. Peace.
Hey, CROC Nation, if today's message inspired you, please subscribe, download, and share this episode with your friends or someone who you believe needs it. Visit us at crocvip.com to connect, learn. Let's spread hope, one story at a time. Until next time, remember, we are not just a podcast, we are a movement.